Dr. Rachel here in our Barnegat office at Thompson Healthcare and Sports Medicine. I'm here with my patient Jess. Jess came to me a couple of weeks ago and she was having back pain kind of to the side, and we diagnosed it as rib pain. So after a couple of treatments, she's been feeling great, really hasn't come back. So what I want to do today is explain a little bit about ribs, how they can get stuck and how we can fix them. So similarly to spinal joints, we also have rib joints that are really close in proximity with the spinal joints. If you've ever been to a chiropractor in the past, you felt them do that adjustment, that manipulation. What it does is it opens up the spinal joints, opens up that spinal area. Ribs, similarly, can get stuck the same way. So they need to be adjusted as well when needed. So two different ways ribs can get stuck actually is in the back and in the front. The way this would present typically is that someone would feel like, I can't take a deep breath all the way in. I feel like my breathing is off, it's just painful to breathe. Sometimes the pain can actually wrap around the area in kind of a stereotypical pain pattern. Sometimes they'll tell me there's like one specific spot and it hurts really, really bad. Those are kind of some identifying factors in how I know it's a rib. And that's kind of what Jess came in with initially too. So when it comes to the adjustment part of it, I can adjust it from the back or from the front. So what I'm gonna do in a little bit is actually demonstrate a couple of adjustments that I can do before this. Okay, so we have a couple different ways that we can adjust this rib. First way would be when the patient is lying prone or on their stomach. What I would do is use a drop table. This actually makes it a little bit more comfortable for the patient as the adjustment is a little bit aggressive. So what I would do is I'm gonna pop the table up, I'm gonna jump up for 1 second, and when I apply pressure, the table drops down with me. So what I would do, pop the table up, contact that painful rib, have her breathe in, breathe all the way out, and I would add a little quick thrust or quick drop to it. If that is not comfortable for you, there is another way I can do it. So I'm gonna have you lie back on your back. This way, scoot down just a little bit for me, and give yourself a big hug. So I can also do it this way, like I said, if that is more comfortable for you. So what I would have you do is roll towards me just a little bit. Instead of contacting the spinal area, I would actually contact a rib instead. So kind of contact it this way, take a deep breath in for me, let it all the way out, and same thing, I'd apply a little bit of pressure down. So those are two ways to treat the rib if it is actually stuck posteriorly or towards the back. Last one, I'm gonna have you stand up. This one is probably the least comfortable one, but it's also very helpful when you are experiencing this pain. So sometimes, like we said before, the rib can be stuck backwards. It can also be stuck forwards. So for this one, I'm just gonna have you relax. I'm gonna contact that rib right up here. I would give her a big hug. I'd have you just relax on me. You take a deep breath in, take a deep breath out, and I actually apply a quick little thrust towards me. Like I said, it's not gonna be the most comfortable thing in the moment, but you may hear that big cavitation, feel that little pulse, and all the pain should be relieved pretty quickly. All right, so we're here on the floor demonstrating a couple exercises that you can do at home yourself to kind of keep some movement in this area and keep these ribs from not being where we want them to be. So first exercise is gonna be diaphragmatic breathing, a technique called box breathing. So I'm gonna have you put one hand on your tummy, okay, one hand on your chest. I'm gonna have you take a deep breath in through your hand. So I want you to feel like just your hand is lifting up, not your top hand. To make that last about 4 seconds. Once you get there, hold it for 4 seconds and let the breath out for 4 seconds and then relax for 4 seconds. So a little bit easier said than done. You want to practice this technique a couple times a day just to kind of induce movement out of this part of your stomach and teach your body how not to activate some of those muscles that we don't need to activate. So I would recommend doing that a couple times a day just for practice. Second exercise is going to be the book openers. So I'm gonna have you lie on your side, actually face that way. Okay, scoot back just a little bit towards me. Have you straighten your bottom leg and then bend your top leg and relax it right on this. And then from here, I'm gonna have you put your hands together. I want you to open your arms like a big book. Perfect. And bring it back nice and slowly. So what this exercise does, by keeping your pelvis like this, it kind of locks it in, so all the movement is happening right through your mid-back, which is what we want. So I'd recommend doing about 8 to 10 in one rep and doing that a couple times a day. Okay, beautiful. Last exercise for me, I'm gonna have you on your hands and knees. Please get this out of your way. And face this way for me. Okay, all right, this is called the CAMEL exercise. For this one, what I want you to do is first sag your belly down as as far as you can. Let your butt almost stick up a little bit and actually lift your head up towards the ceiling. Good. Very slowly, I want you to try to kind of hollow your back, feeling like you're going one vertebrae at a time. Nice and slow. Good. And lift this up as high as you can. You see how she's getting all of that movement through her mid-back? That is what we want. We want to kind of get that movement, get those ribs moving, get that mid-back moving. And same with this, I'd want you to do about 8 to 10 reps and about 2 to 3 times a day. All right, so thank you guys so much for watching. If this is something you're experiencing and this is something you need help with, give us a call at one of our 11 Thompson Healthcare locations.